Good morning, everyone. My name is Maya Luria with TMC for Seniors, and today we are continuing on with our Diabetes Month, and we're going to be talking about your oral health. So, oral health, navigating the intersection of diabetes and oral health. I have Melody Leavitt here with me. She is a registered dental hygienist with Coronado Dental. How are you today, Melody?
I'm great. Happy to be here. Thanks for having me.
Yeah, so you did a great presentation for us before on oral health and aging, and so I asked you, could you do something about diabetes? There is a whole link there, and so I'm really excited that you're here to do that for us today. I'm going to go ahead and put your PowerPoint up for you. You have an online audience, so if you're watching from home, please leave any questions for Melody in the chat, along with an in-person audience. So welcome.
Thank you so much. I'm happy to be here. I'm a walker, so I'm going to be kind of going back and forth. But I was really excited for the opportunity to be here today because there is a large correlation with oral health that can affect those that are diabetic. It's personal to me because my dad is diabetic, and so this is something that even though he was a dentist, I'm constantly reminding him. So I'm just going to give myself a little intro here. So again, Melody with Coronado Dental. I am a native of Tucson, born and raised. A little backstory about myself. My dad was a dentist here in Tucson for almost 50 years and worked with him since I was 14 and loved every minute of it. Up until the point where a new doctor came in and was very corporate based. After my dad retired, the new doctor came in, and kind of my tipping point is when he gave my 87-year-old patient a $30,000 treatment plan. And for me, it was just really difficult because we were more conservative, but it wasn't something I wanted to be a part of. So I found my new home with Coronado Dental. Coronado Dental, we are a mobile bedside dental provider that offers dental services to seniors in communities like assisted living, memory care communities, skilled nursing homes for those individuals, whether they're seniors or younger, that can't get out to have their dental care done. So I found my new niche, and I love it because it is an active service for those individuals that can't go out. In the private sector, we would see with my dad's patients that they would grow with our practice and then they would just stop coming because physically it just became more difficult. And so to be able to carry on those traditions of helping residents in these situations has been very fruitful. My kids, up top, my family, I'm a mom to 3 beautiful daughters. My oldest daughter with my grandson lives in Maine, all the way across the country. And I have a middle daughter up at NEU, and my youngest daughter is a senior at Sabino. So they're growing quickly. But I do love what I do and being a mom, but also with my career. So I'm going to go in a little bit about how diabetes can affect us with our oral health and things that you can do to help this disease process. So the mouth is kind of the window to the body. So I always kind of like to preface, if you think about the proximity with our mouth to the brain, the mouth to the heart, the mouth to the lungs, it's all interlinked. And for those that may have systemic diseases, autoimmune, things like that, the mouth really kind of correlates how those diseases can either be more aggressive or on the contrary, actually slow down. And so with diabetes, that's going to be our focus today, but I am going to touch point just really briefly on some other things that can happen for those that can be affected by the oral health. But for those that are diabetic, it can interfere with the glycemic control for those that are diabetic, cardio risk, pulmonary risks, and mortality, as well as pneumonia. As well as COPD, Alzheimer's, dementia. I'm on that board. And people don't understand that if you're not taking care of your teeth, it actually can expedite that process. But on the contrary, if you're actually taking care of your teeth, it slows it down. So with someone that has Alzheimer's or dementia, with the medication that they also have, that can actually really slow down that process. Psoriasis, rheumatoid arthritis, lung cancer, like cerebral vascular, so like strokes, esophageal cancer, mouth cancers, colorectal cancer, and cystic fibrosis. So that's pretty amazing to think that your mouth really can contribute to some of these other things if you're not taking care of your mouth. So how does diabetes affect your oral health? I'm going to kind of go into those things with you today, and also the link between poor oral health for those that had diabetes. But like I was emphasizing just moments ago, the good thing is that if you are in that stage of uncontrolled, you can reverse it into a healthier state. So it does go both directions. So with diabetes, I'm going to tell you a quick story with a patient that I had in my private sector when I was working with my dad. And for those that may have attended my other lecture, you may have heard this story before, but it really, really affected me in the importance of diabetes. So this was before COVID, and I had a patient walking down the hallway, and at that time we weren't wearing masks unless we were patient facing. And so this gentleman and his wife are walking down the hallway, and I smell a very strong fruity smell on him. And he hadn't been in for a while. So as I'm sitting him down in my chair, I'm reviewing his medical history, and diabetes is not checked. And so his wife's in the corner, and I said, well, when's the last time you've been to the doctor? And he kind of scuffed, and his wife chimes in real quick. Oh, he never goes to the doctor. I've been hounding him for a long time. And I said, well, I'm sorry, but I'm not going to be able to see you today. And he had waited a couple months for the appointment. He was pretty upset. And I said, I think that you have uncontrolled diabetes. And he kind of got agitated. And I said, the smell that's on your breath, it's a very alkaline, very fruity smell, is an indication that your diabetes is not controlled. And from the looks of his mouth was not in good condition, bright red gums. You could visibly see tartar or calculus present with a moderate amount of plaque present. And so he kind of grumbled, and he wasn't too happy about it. And I explained to the wife, I really think that your husband needs to see a doctor sooner than later. So the next day I get a call, and it gives me goosebumps every time I tell this story. He had gone to the doctor. They immediately sent him to the hospital. He was close to being in a diabetic coma. His blood sugar was through the roof. And so those little things, people come to the dentist to get their teeth cleaned or have work done, but there's other things that we're looking for while we're cleaning your teeth. It's just not getting your teeth cleaned. And that really kind of set me into the mindset to be really thorough with patients, especially that are diabetic, because I started seeing these changes. And with that patient, it sounds dramatic, but I saved his life. So with diabetes, especially, whether patients check that box that they're diabetic, I'm looking in your mouth to see if you have any of these factors. One of the things that I see common is severe periodontitis, where your gums are really red, they bleed easily. You can have a large amount of plaque because you're not maybe brushing properly, or just because you are diabetic and your body produces things differently because you are diabetic. And what happens in this periodontitis stage is that your gums get really, really red, and they will bleed easily. And so if I even barely touch it, you're going to start bleeding. That's not a healthy gum at all. It should be actually the opposite, where you touch it and no bleeding at all. It should be a nice pink to light pink color. And so what happens is when you are diabetic, the body can't, the ability to use the insulin properly is not happening, and it can manifest in the mouth first. So if I'm seeing a patient and they're sitting down and they have it checked, that's okay. That's something that I'm going to see in a patient that I expect in diabetes. But if it's not, I'm going to have that conversation with the patient. Have you been tested for diabetes? Has your A1C been checked lately? To have those kind of conversations, because believe it or not, there's a lot of us that maybe don't like to go to the doctor, let alone the dentist. And so to open up that dialogue where you can have those conversations and say, this is something that's not normal. Let's get your teeth cleaned. Let's see if it improves in 6 months. And if it doesn't, then we really need to kind of address things in a different fashion. But when you have high blood sugar, it affects obviously your diabetes, but it can actually lead to gum infection as well. And so things that we may see with a patient that is diabetic is that you may get an abscess or a draining fistula. That's very common if you're not brushing your teeth, because the infection rate increases substantially. As you know, for those that are diabetic, in this process, it's much harder to heal. So even if I come in as a dental hygienist and clean these areas up, that infection rate is going to take longer to clear up, because it's a slower healing process for those that are diabetic. The other thing that's very common for those that are diabetic is the lack of saliva. It's very, very normal to have what's called dry mouth, and I'll go into more detail about that later, but it's very common for your mouth to feel very dry. That could be a combination as we mature, as my dad would like to tell us. It could be that from the diabetes itself, it could be from medications. Hundreds and hundreds of medications cause dry mouth, which wreaks havoc on the mouth. And again, I'll kind of go into a little bit more further down in the slides. I've kind of tapped into the gingivitis with the bleeding and the inflamed gums. Tasting food, that can become problematic as well, which is very, very common, especially for those that are denture wearers, because maybe the top denture will cover your palate. And that kind of aids to like the tasting factors or your tongue. The same thing if you have dry mouth. So there's lots of different factors that can affect those that are diabetic. But the good news is I'm kind of here to help you with some tips that can explain what we can do to help those if you are diabetic. I've kind of touched on these others, delayed wound healing, you're more susceptible to infection in the mouth. But again, we can change that by changing some of these habits. So I'm going to kind of go back to basics, which I think is important because I think we forget sometimes with oral health and what happens. So you have the healthy gums. When you have healthy gums, your gums should be pink to light pink. There should be no bleeding, and it should be free of like tartar, which is calcified deposits. Our body is pretty amazing that every 12 hours, it generates plaque. And what that is, if food particles are left in your mouth or bacteria is in your mouth, it's constantly cycling. So that's why we ask you to brush twice a day, once at night, once in the morning, because of those circular changes every 12 hours. But in the event that maybe you're not feeling well, I recently had surgery and I was in the hospital for several days and I didn't feel like really cleaning my teeth. During that time, what happens is you can go into what's called gingivitis. You're not brushing as thoroughly. You may miss a spot or two or not brushing at all. And that plaque that has, again, food particles, which if for those that are diabetic, starchy foods break down to sugar, which can break down to acidic type of an environment. That's what starts to happen in our mouth in combination with food and then with bacteria. That's when your gums start to get a little angry. So for those that have ever started brushing their teeth and maybe get a little blood on your toothbrush, this is called gingivitis. Or flossing, the same thing. I kind of chuckle because several years ago, there was a study that came out that there hadn't been a study that I think it was the government came out and said, well, there hasn't been a technical study on the importance of floss. And it became this huge uproar in the media about, oh, you don't need to floss. And so every one of my patients for that whole 2-week period that it was blown up in the media came and said, well, I'm not going to floss. It hasn't been proven to show that it's effective. And I said, well, go home for 1 week and stop flossing and see what happens. And after 4 days, one patient called me and he said, all right, I see your point. Because the body is, again, pretty amazing that it realizes that there is a foreign object, if you will, or something that shouldn't be there, and it starts targeting. And part of that is it starts to bleed. It's in an inflamed state. And so flossing is very, very important, which again, I'll go into. But with gingivitis, the good things is it is reversible. So after my surgery, I was feeling more up to it. I started brushing again more regularly, sometimes 3 or 4 times a day. I included flossing in that, and then it stopped bleeding. So that's a good thing. However, for those that maybe go longer periods of time, it can lead into periodontitis. I always like to emphasize with periodontitis that some individuals genetically are just predisposed to certain elements. And perio is one of those things, unfortunately. I call it the good old genetic lottery. My dad gave me his kidney stones. Some people are more susceptible to cavity prone. Some are more periodontal prone, where you're going to start losing teeth. And so with each individual, it's different in how I may approach that patient. But with periodontitis, again, the good thing is it is reversible. So what happens with periodontitis is you have the plaque that builds up every 12 hours. Then what happens, it's kind of like a drippy faucet. If you can imagine the drip, drip, drip and how it gets that calcium deposit, that's what happens in our mouth. We have salivary glands that are on the inside of our tongue and also on the outside of our top cheek areas on both sides. So it's like a drip faucet and dripping faucet, and it builds up calcium. Now, some people, again, are more genetic to build tartar or calculus. I have patients, it's interesting, redheads, for whatever reason, can build up a lot more. But genetics do play a factor in things. I actually saw a patient yesterday down in Sierra Vista cleaning her denture, and she had just tartar all over her denture. And talking to the care staff and to her daughter who was present from Bisbee, we had the conversation that even though that you have dentures, you can still build up tartar in those areas that needs to be removed. So just because you may not have or you have artificial teeth, those are still things that need to be cleaned. But with periodontitis, again, when the tartar builds up, it can go down underneath the gum subgingivally, and that's when you start to get deeper pockets. So how many of you guys in the room have gone to the dentist and they're probing with that little probe and they're calling out numbers? Yeah. 2, 4. Well, that is what they're checking for. The reason being is 1 to 3 millimeters is a healthy gum. So it's kind of like between the tooth and kind of like almost like a pocket. You put the probe down, it should stop around 3 millimeters. That sulcus should be healthy. However, if you have a lot of plaque buildup or the tartar buildup, like the deposits that I was speaking of, it actually releases toxins and bacteria that cause that pocket or that gum tissue to become deeper. And when that happens, then you run into issues like where teeth start to get mobile, or you have infection down in that area. Because if you think about a deep pocket, you may only be able to go down so far, but at the very bottom, it's a little harder to reach, especially if you have jeans on. And so what happens is that for certain bacteria, that's like the perfect harbor area for bacteria. They like it dark, it's cooler down there, and it's kind of a breeding ground for periodontitis. But the good news is maybe it's been a while since your teeth clean, or maybe you're just one of those unfortunate people that are more susceptible to periodontitis. You can come to the dentist and we have instruments and we're able to clean your teeth. Sometimes for individuals, if it's been a long time, sometimes it can take up to 3 or 4 appointments to get you back to a healthier state. And then you're on a maintenance from anywhere from 3 to 4 months if you're more periodontitis prone or periodontal issues. For most of us, it's every 6 months, which is usually a fair amount between. But if you're maybe more cavity prone, we have bumped patients to a 3 or 4 month recall because you want to stay on top of their oral care, especially for those that are diabetic. I will emphasize this. Most insurances will only cover 2 a year. If you can afford it and you are diabetic, it would be an advantage to have that extra cleaning, that the dentist can really keep an extra eye on you, and that extra visit, something you can take, pay out of pocket. You don't even need the doctor come and exam you during that time because they'll see you maybe once or twice during that year. But I always encourage my patients that are diabetic for that reason. When you start running into advanced periodontitis, as the picture here is the last slide, you can start seeing the gums have now receded away. The root of the tooth is exposed, which I will note that because I'm going to talk about that a little bit later. And you start getting teeth that are mobile, and then you start losing teeth. And that's when you run into issues like where you need to have some teeth replaced by an artificial appliance called either a partial. A partial is where you still have a few natural teeth, but it will replace some missing teeth. And then a denture is where you've lost both your top and bottom teeth fully, whether it's the top or bottom or even both. And it's interesting for those individuals that have that because sometimes it's a genetic factor. Their parents, had lost their teeth when they were really young, and they remember mom taking them out, putting the teeth in the glass. And so, but then there's others that are more aware of that, and they really try to take better care of their teeth, but they still end up losing them, unfortunately. So here's a patient that I worked on, and you'll see this is the tartar that I was talking about. And this is actually kind of a yellow color. I've seen patients that are smokers or heavy drinkers that this turns black. Tea drinkers, again, get a lot of staining, but even types of foods like blueberries, strawberries, sometimes they'll get like different hues to it because of the foods that we eat. But this is the calcium deposits. This is on the lower anterior, which is the most common area where most people build. I tell people I'm a fanatic with my teeth. I brush 4 or 5 times a day. I still build a little tartar. It's just the nature of the beast. But this, again, can be removed. As you can see, this is the healthy tissue. But underlying, you can see how that red gum is surrounding the sulcus. That is gingivitis. The gum is angry right now. And so when I'm cleaning the teeth, you are going to have a little bit of bleeding. But again, that is normal. People that are diabetic, because you can't break down the sugars properly, you end up having a lot more plaque, which in turn will turn into calculus. This is very common with my patients that are diabetic. And so you're just more high risk for this. And so by adding that extra cleaning really could be advantage, because this can build up pretty quickly if you're not doing proper brushing. So as I was talking about dentures, this is another patient that I had seen. Now this may be different for most of you guys because I work in senior living, and so I have memory care patients or people that just physically maybe have had a stroke or just can't take their dentures in and out. Care staff is understaffed, or maybe they just aren't educated on the importance of taking out these dentures for these patients and helping them clean. But with my company, our company offers 4 cleanings a year for these individuals because we understand the importance of systemic health and how oral health can affect everything. So if you already have a patient that is immune compromised and then you add in the factor they're not taking care of their teeth, it really, really can expedite the end of their life. And we emphasize the oral hygiene and the prevention side of things because of this reason. It's very, very important. There's times where I go into a community 3 months after I had seen that patient and they had not taken out their denture since the last time I was there. That happens a lot. And even if you are a senior that maybe is at home, maybe having dementia, family is kind of taking care of you, kind of the same things can happen too. But with diabetics, again, it goes back. My patient yesterday was diabetic. You're more prone to building up tartar. And I prefaced earlier that even though these are artificial teeth, you can still build up tartar in these areas. So that's something that I clean on all my patients. So I'm going to touch base on dry mouth. I saw some people nodding their head when I spoke of this. This is one of the big factors with people that are diabetic. It is a big issue. Unfortunately, there's not a lot that you can do to prevent this because this is just one of the side effects of being diabetic. The saliva production decreases. And then in addition to, a lot of people that are diabetic are taking medications. And medications, again, hundreds of medications cause dry mouth. So it doesn't just affect those that are diabetic. It actually can affect people that are asthmatic, or if you have other issues going on. Look at the label. I always joke about those, commercials where it says 5 seconds of great things about the medication, and then the other 55 seconds is about side effects. And dry mouth is definitely one of those. I've seen it firsthand in the dental practice where patients, they start a new medication, they come back 6 months for a cleaning and their mouth is bombed out. And again, I see this with my patients that are diabetic that are uncontrolled. And I always like to emphasize that because I don't want to scare those that are diabetic. You can have good teeth if you're taking care of your oral health properly. But those that aren't, it wreaks havoc on the mouth because it causes your mouth to become more dry, which in turn can cause it to be more acidic. And for those that are more cavity prone, it really can just wreak havoc. The other thing I wanted to also say is that for those that have dry mouth, a lot of times people will suck on lozenges because it helps them kind of stimulate the saliva production. However, I had a patient that did this and they didn't realize that there was sugar in the cough drops. So hours and hours at a time, this individual was sucking on these lozenges, and I knew exactly where it was because it was the back lower left, and all of his teeth on the left side were bombed out because it's long exposure. So I tell people, like, even if you have a candy bar, you eat it, maybe within 10, 15 minutes. That's 15 minutes of exposure. But for those that have lozenges that have sugar, it's hours and hours. Or people that drink soda all day long, the same thing. It's about the exposure time, not about necessarily what you're eating. In short periods. I don't want you guys to have Snickers every day for 15 minutes and say, oh, it's not long exposure. That's not the point. It's just if you're going to be sucking on lozenges, please make sure that it is sugar-free. That's super important. But unfortunately,
what do you think about the biotin gel that you put in your mouth?
So I'll kind of go into that a little bit, but with dry mouth, there are substitutions that you can do. Unfortunately, they're not the best, but something is better than nothing. But I'll kind of go a little, that's a great question. I'll go more into that later in the lecture about things that you can do. But unfortunately, it's not the best. For those of us that may have bladder issues, we encourage you to drink lots of water, but then you have to go to the bathroom. So there's always kind of, the pros and cons to everything. However, there are things that you can do to try to alleviate some of that dry mouth in your mouth. Tobacco use can also increase that. So if you're diabetic, we strongly encourage you to try to stop smoking. I know it's a hard habit to break, one of the harder ones, in fact, for my patients. But that really can increase your issues with your oral health, especially if you're diabetic. Nerve damage, and so sometimes people lose sensation on their tongue due to the dry mouth. That's very common. I actually saw a patient yesterday, again, Sierra Vista. This patient was advanced Alzheimer, but also was diabetic, and she has the burning tongue. That can also be a common factor for those that are diabetic from the dry mouth, and again, from also some other things that can go on. But that is one of the things that I see a lot with my patient with the burning tongue. But there's also a lot of underlying issues that can be contributed. I won't go into too much of that, but diabetes is the one we're going to focus on today. So root decay. So I kind of talked to you guys about periodontitis and the advanced stage of it and what was happening. So when the gums recede, the root is exposed. And you can see here kind of the dark area. That's not necessarily a cavity per se, maybe up in this area. But the root of the tooth, maybe this is a better picture, and how it is more yellow, that is actually the root of the tooth. The root of the tooth is only 1/10 as strong as the enamel. So most of us, and maybe part of your generation, you guys love medium to hard brushes. I don't know why, but that was a thing. And so people went to town, and what happened was they were wearing away their gums. And so a lot of you may have some gum exposure. And during this time, what happens, it's 1/10 as strong as the enamel. Then you throw in the factor that maybe you're diabetic or you're on medication and it causes your mouth to be super dry. So in that instant, food debris is going to stick. And where is it going to stick? Right at the gum line. And because it's only 1/10 as strong, it's an area that could be easily targeted for decay. So again, for those patients that are diabetic, or even some of my patients that cause severe dry mouth, I will put them on a 3 or 4 month recall, because in 3 or 4 months, they can start getting these root decay as seen in these pictures. And it's very close to the nerve, and it's a very expensive fix. It's a lot of times they have to have a root canal and then a crown. And in some instances where it just blows up very quickly, the tooth actually has to be extracted. So this is very, very common. So for those that are diabetic, you really have to be cognizant and aware when you're brushing to really concentrate at that gum line, keep it nice and healthy and clean. And again, I'll kind of go into a little bit of that later in the lecture. So for those maybe don't like pictures like this, you may want to turn away. But again, we had talked about infection in the mouth. So with those that, again, are diabetic, you have a higher risk of infection. And one of these is called a fungal infection called oral thrush. So this is very common for maybe people in senior care homes, but even seniors that may be living at home that aren't taking care of their teeth or brushing as thoroughly. In this instant, this is a patient that has oral thrush. And the only way to treat that patient is to get them on an antifungal and get that cleared up. It can spread throughout the mouth and can be quite uncomfortable. But this is something that I see probably weekly, if not maybe 2 or 3 times a week in patients and communities. Very common. So some challenges that people may have as we mature is that it's difficult with some of these issues. So 72 to 94% of seniors may have issues with some of these. Dexterity, whether that's because you've had a stroke or maybe you've broken something, or just mobility wise, it's very difficult. Vision. So when you're looking in the mirror, maybe you're not seeing as clearly. I did that the other day and realized my contacts were in and I couldn't see up close. And so those kind of things can affect it. And then just your cognition. So like if you have memory care, they're just forgetting altogether to brush the teeth. And this is very, very common again in seniors, and why our company is so dedicated to offering 4 cleanings a year, because it is so important in this with this age group. So I've kind of touched base on some of the things that can occur if you are diabetic and how it can affect your oral health. Now I'm going to go into the positive things, which I always like to speak about, and how tips that I can help you if you are diabetic, uncontrolled or even controlled, and how to keep your mouth healthier. So by maintaining good oral health, it can help control your blood sugar. So again, if you are brushing more regularly, twice a day at least, that's going to decrease the bacteria load in your mouth. So for those that are diabetic, again, the insulin isn't breaking down properly, and so that becomes more acidic in your mouth. That's probably one of the biggest things that I see, is that there's a lot more plaque accumulation. But that, again, by just regular brushing, it's really important to, even if you have a toothbrush handy, I'm that person that brushes in the car, I'm watching TV, I just do what's called dry brushing. You don't even need toothpaste, you just kind of massage your gums. I tell my patient, who wants a massage? Because it feels good just to kind of go around your gums and do that, and that's something you can do really easily if you're at a red light. I'm over people looking at me weird in the car. Doesn't bother me anymore. But there is a big role in regular cleanings, brushing regularly, especially for those that are diabetic. That's very important. And also tongue cleaning. Everyone always forgets the tongue. So please help yourself to the goodies I brought today. And on the back side of the toothbrushes that I provided is a tongue scraper. That is something that everyone should be doing on the daily, especially if you're a coffee drinker, tea drinker, that actually can stain the top of your tongue or the papilla. And so that's something that we encourage you to do. For those that don't, it can lead to halitosis, or a fancy word for bad breath. So I know we had somebody ask a quick question about the oral care products. I'm going to kind of go into that, the difference between manual or electric brushes, toothpaste, floss, and then the interdental brushes, and then of course mouth rinse. So with brushing, we'll go back to basics again. And so the tooth is here. You want to hit it at a 45-degree angle, small circular motions. This is with a manual brush only. If you have an electric brush, which I highly recommend, this is my favorite time of the year because I stockpile electric brushes from Costco. If anyone has a membership, either there or Sam's Club, they always have Oral-B's on sale. It doesn't matter which brand it is, but you can get it very, very affordable this time of the year. So maybe grandkids, you may want to stock up for them. Because what I find with patients that use electric brush, it does a much better job cleaning their teeth. As a reminder for those that do have an electric brush, hold it in place and let it do its job. A lot of times we move it. When you do that, it can actually cause some of the gum to wear away by causing some gum recession. So just hold it in place. There are certain ones that vibrate or beep that will kind of tell you to move it forward. Depending on the size of the head of the brush, you can even see 2 to 3 teeth at a time, sometimes larger, just depends on the area. But that's super important just to let it do its job. But a lot of times people forget that. A lot of times people like to do that brisk horizontal movement back and forth. Again, that can cause gum recession, which could lead into issues with root decay that I showed previously. So the dry mouth, this is a very, very common patient for a lot of my seniors. The Biotene that was mentioned today is an artificial saliva replacement. It's not the best, I'm not gonna lie. I've tried it myself because I'm that type that wants to try something before recommending to my patients, but something is better than nothing. The other alternative is to drink lots of water, but again, then you have to go to the bathroom a lot. So you have to be close to the restroom if you're drinking a good abundance of water. But that's super important for people that are diabetic. You need to keep hydrated. That's also going to affect, on a positive note, with the tongue, to keep your tongue moist, so you're not going to have that Brillo pad kind of filling in your mouth. That's probably one of my biggest complaints, and then patients that complain about like a burning tongue as well. So that should help. But they have different like lozenges. Again, these would be sugar-free, and they have like gels that you can put into your mouth, and of course water. Most patients find that they like water better. The tongue cleaner that I just kind of touched on just a few slides ago, that's super important as well. Again, on the back side of your toothbrush, you should have that, or they actually have something that is designed as a tooth cleaner, something similar to this. Again, that's super important. We've kind of touched on this already, but dentures, it's very, very important to clean your dentures. So for those that are diabetic, I still encourage you, the proper way to clean your dentures is to take them out at night. I have patients that have never taken out their dentures. They were never educated on doing that. And so what I see in that case is when I take those out, their gum or their palate is a fire engine red. It's very angry. And the gum in that area is very unhealthy, or the tissue underneath, and that can lead into the yeast infection that I showed you guys earlier, the candidiasis. And so we always encourage you to take it out at night. Brush it before you put it in your little cup. You can just put in water. Some people have the denture tablets, which I encourage you to do. That will break down some of the particles that form that maybe calcify a little bit more. but that should be done 2 or 3 times a day if possible. You don't have to keep them out during the day. You know, you can keep them in, but just make sure that those are coming out at night. That's very, very important. Again, soaking dentures, that is going to be something that we highly recommend. Again, with the tablets, you can do that overnight. But with brushing, again, it's basic. Twice a day, flossing at least once a day. That's super important. I get a lot of questions about the floss, and let me try to get there a little bit. Okay, I guess I didn't have that slide in there. But with flossing, I always kind of like to tell you guys the tooth is kind of shaped like a C shape. So when people floss, they kind of go up and down really quick. That's not really proper flossing technique. You really need to hug the tooth on either side and give it a C-shaped side. As we get older, sometimes the dexterity is a little more difficult. And so I encourage patients to get floss picks because they're a lot easier. I love the fact that you can keep them in your car or pockets and you can do them at any time. But again, when you floss, you're going to go down and really hug the tooth on either side and then up and on the other side. If you're flossing manual, it's the same thing. There's also a water pick that you can get. Again, this is another great time of the year to get those. I encourage patients that you need to do both. I do my floss pick first, and then I go in with my water pick thereafter. It's amazing still how much stuff comes out. So it's not a replacement with the water pick of flossing. You should be doing those together. And the other thing with the water pick that I always like to emphasize, they have levels 1 to 10. Don't start at 10. That actually can blast your gums. Like, it's not healthy. So even with the interdental brushes, like little proxy brushes, they're kind of shaped like a Christmas tree that sometimes your dentist will give you. Those are great for those that maybe have some gum recession or maybe some pocketing in between their teeth. When you feel that resistance, that's when you need to pull back. You don't want to force anything in the gum area because that actually can cause more damage. So just be really gentle in and out. So kind of as a recap, you're going to brush morning and night, either with a manual brush and an electric brush. Please, if you're manual or you're electric, hold it in place. Floss, you can do floss picks, the regular interdental. They have little Stimudents. There's lots of different products on the market. But in doing that, just make sure you're not forcing those things. Mouth rinses for dry mouth, you have the Bioteam, or even antimicrobial rinses. Again, when you're looking for like a Listerine rinse, make sure that it is alcohol free. I have patients that come in like, oh, it's burning. I love that sensation. I said, that's not necessarily the best thing for your mouth when it's already in a dry state. So I think it's a light purple. Every brand is different, but make sure it has alcohol free on that. That's very important. For those that are dentures wearers or partial wearers, make sure you're taking that out at night. That's super important. You're brushing them just like you would brush your natural teeth. And then, of course, regular visits to the doctor. That's really going to be one of your saving graces. Besides you taking good care of your teeth, is to get a regular checkup with your doctor, whether it's twice a year, even once a year I'll take. Ideally, it could be 3 or 4 times a year where the doctor can keep a closer look on you because you do have factors being diabetics with the dry mouth especially. And again, the good news is even though you're diabetic, you're not doomed. There's great positive things you can do to keep your oral health in check. But on the contrary, if you're not, it's really going to cause a lot of issues in your mouth. And as you know, with diabetes, it affects the whole body. And so the mouth especially is something that can be affected because I tell my patients it affects so many other things. Again, the brain, the heart, the lungs, and other things. So I'm grateful to be here today, and I think I'm ready to open up to questions. It's not working. I'm sorry, I can't hear you, my dear. It's okay.
Okay, I can ask you the question.
Okay, she's gonna come get the questions.
Hold on, can you hear me?
Oh, there you are. There you are.
Wonderful. Okay. Sorry, we've had some technical difficulties this morning with, that's why we started a few minutes late. So I had a couple of questions that came in. One was around medications. Are there medications that people take for diabetes that affect your dental health? And are there any steps that you should, take when you're taking care of your oral health with these medications?
So absolutely. I mean, there's so many different brands of diabetic medication anymore, so I don't want to get specifically to them, but I would encourage anyone that's taken any sort of diabetic meds to look at the back of the label. That's going to give you all of the ingredients, but then also the side effects that will be listed. And again, they have a lot of great benefits, but then you look at the long list and there's a lot of side effects. And a lot of medications, again, either whether it's diabetes or other medications that are for other issues, one of the biggest side effects is dry mouth. So I would encourage you to look at the label because they're all so different. And again, touching base, just oral care. You want to make sure you're brushing regularly, flossing regularly, seeing your doctor regularly as well, because that they're going to catch things when they're smaller.
Great. What about those water pick flossers? Are those better than regular flossing?
So I kind of touched on that a little bit. I encourage people to do both. The reason being is because it doesn't take over the job of the floss. I personally do both, where I've actually flossed and then gone back and used my water pick, and it's always amazing still what comes out, as gross as that is. So you want to use it in conjunction with. But at this point, I tell my patients, I will take one or the other. Just make sure you're doing one. That's important.
Okay, that's great. And what about, is there anything around probiotics in terms of dental health?
Absolutely. So that is something that we encourage patients to take, the probiotics, because it can affect the mouth in a positive light. Everyone has different bacteria in their mouth, but there's the good and the bad. And so if you want to introduce the good, sometimes that kind of overtakes some of the bad. So that's something that we do encourage patients to do as well. That's a great question.
Okay. And what about the effects of artificial sweeteners? You know, thinking if somebody may be diabetic, maybe they're using an artificial sweetener as opposed to just, sugar or another sweetener.
Absolutely. So we have been finding that there's become a lot more research with it. There was such a contrast where they said no sugar at all, and then they went artificial, and then we found that some of the artificials actually are worse. I always kind of compare it to the butter and margarine kind of argument, but we have found that even with some of the artificial, it causes dry mouth as well. As far as breaking down the sugar part of it, it's actually better, but it can be drying. So it's kind of a double-edged sword. I have always been taught everything in moderation.
Right. Okay. Thank you. And I think I've got one last question that came in. No, I want to ask you though about Coronado Dental. So your practice is a little unique and different from most. Will you just share sort of how the practice works and where you normally are seeing your patients?
Absolutely. Thank you for that. So Coronado Dental, we are a bedside mobile provider. So we do not have a brick and mortar building. We actually have our little cars. You'll see us around town. We have our cars that are wrapped, and we go into communities for seniors or individuals that are into like a memory care, assisted living, group homes, skilled nursing facilities. So for maybe somebody that had a hip replacement and they're having long-term care, they have to go into a rehab. We are seeing those individuals that can't get back to their house. So again, going back to my dad, he was a dentist here in Tucson for many years, and his population grew with him, and then they would stop coming, whether it because they were in a community and they couldn't get out, or just because it became more difficult mobility. We are not in private homes yet. That's something I'm working on my bosses with. However, we see all sorts of patients that have maybe been trached or intubated due to drug use, to car accidents, to people that suffer from dementia, Alzheimer's, more mental health issues. We see a wider range of patients. And I have to just preface, I love what I do. It really is an act of service for some of these individuals. And since I have a little bit of an audience, I want to encourage our company this year is really encouraging the public to help a senior. So you guys are all independent. You guys are out and about, whether it's a family, friends, or maybe somebody in a community that you may know or maybe not know. If you have like a assisted living that's close to where you live, maybe drop in and see if you can adopt a senior. I find that these individuals are very, very lonely. And, we all may be there someday. So I always say, it's a golden rule, pay it forward and try to help. So just want to encourage people to see if that's something you would be interested in doing.
Oh, thank you, Melody.
course.
My last question is, I know you talked about the Oral-B toothbrushes or, something like some of those electric. Any thoughts on the Quip, which is the battery operated toothbrush? Are those as effective? Do they work too?
That's a great question. So I always like to tell people a brush is a brush. I know there's lots of bells and whistles. And when my dad retired, I hadn't gone to the grocery aisle because we would just take from the office and we had that leisure going to conventions. I was overwhelmed with the amount that the consumer has walking down. It was almost intimidating. But what I found in my private practice, I have had patients that have gone to Walmart and got the cheap $5 brush and they've done a great job. So it really just depends on what your preference is. The Oral-B's work great, but sometimes people don't like the vibration. So it really is just your own preference and maybe how much you want to spend. But again, it doesn't have to have all the bells and whistles, as long as that you're doing it properly with the electric brush, just holding it into place.
Great. And is a softer bristle better for your teeth, or as compared to maybe a harder?
Yes.
bristle?
Yes. So I kind of touched on that a little bit. We discourage medium to hard brushes. We only encourage soft, extra soft. For those patients that have a lot of gum recession, we always encourage extra soft brushes. The one complaint that I get from patients is that maybe they don't feel it does as good a cleaning. It is. It just maybe did not feel it. A lot of people like that hard brush because it feels like they just cleaned it, but it really does a lot more damage. So always an extra soft or soft brush is what we encourage patients to look for.
Thank you so much for being here, Melody. I'm going to wrap it up with our online audience, and I'll turn it over to you for anyone in person, okay?
Great. Thank you so much. Thanks for having me.
Thanks. Thanks again for being here today. We are wrapping up November. We've got a couple more things that are happening this week before Thanksgiving. We've got the Inside Story, which is tomorrow morning at 10 a.m. That's Wednesday, November 20th. That's going to feature Jed Dodds, who is an animal care staff with the Reed Park Zoo. That is an in-person only class, and if you're interested in that, you can give us a call in the office. The phone number is 520-324-1960. And then tomorrow afternoon, we have What's Ringing in My Ears, Managing Tinnitus. That is Wednesday, November 20th at 2 p.m. With Haley Lanou. She is an audiologist with her outpatient therapy in audiology. Again, if you are interested, the class is full in person, but there is plenty of space if you would like to join online. The number again is 520-324-1960, and we can get you registered for that. And I hope everyone we'll see you all soon. We'll be back tomorrow, and then I hope everyone has a great time this holiday season. Thank you.